We all experience stress at different stages of life. Sometimes it's the anxiety before an exam, the tension before an important interview, or the pressure of finishing a tight project deadline. In these moments, your heart races, your hands might shake slightly, your body releases more energy, and when it's over, you feel relieved and return to normal. This is normal stress, the body's natural and temporary response to challenges. Normal stress actually plays a positive role. When facing pressure, your body triggers the fight or flight response, releasing cortisol and adrenaline. These hormones increase heart rate, improve focus, and boost reaction speed. As a result, you might deliver a better presentation, sprint to meet a deadline, or pass a tough test. The key point is that normal stress is short-lived and disappears once the situation passes. However, stress is not always a friend. When pressure is no longer temporary but continues for weeks, months, or even years and the body has no chance to recover, it becomes chronic stress, a dangerous state for both physical and mental health. Chronic stress happens when your nervous system stays on constant high alert, keeping cortisol levels elevated over time. The feeling of tension doesn't go away, but becomes a permanent part of life. Causes of chronic stress vary: ongoing work pressure, toxic workplace, family conflicts, financial burdens, or unresolved trauma. If normal stress is like a quick rain shower, refreshing and short, chronic stress is like a slow, relentless storm that floods your health over time. Chronic stress can lead to insomnia, constant fatigue, weakened immunity, digestive disorders, increased risk of heart disease, high blood pressure, diabetes, anxiety, and depression. It affects not only your body but also your mind, draining joy from the things you once loved. How can you clearly distinguish normal stress from chronic stress? Duration. Normal stress lasts minutes to days. Chronic stress can last months or years. Impact. Normal stress boosts short-term performance. Chronic stress decreases productivity and causes fatigue. Recovery. Normal stress fades when the cause ends. Chronic stress requires long-term recovery and sometimes professional help. Symptoms. Normal stress causes rapid heartbeat, sweating, high focus. Chronic stress causes insomnia, headaches, depression, and long-term anxiety. Recognizing chronic stress early is crucial. Warning signs include constant exhaustion, even after enough sleep, irritability or unexplained sadness, frequent body aches, forgetfulness, difficulty concentrating, and the feeling of being stuck in a loop of pressure. These are your body and mind's way of calling for help. To prevent and manage chronic stress, start with small but effective steps. Set boundaries in work and personal life to avoid overcommitment. Practice relaxation techniques such as meditation, yoga, or deep breathing daily. Maintain regular physical activity to release endorphins. Stay socially connected. Spend time talking and sharing with family and friends. Seek professional support from therapists or doctors when needed. Stress is an unavoidable part of modern life, but you can learn to manage it. Value your rest time, let go of unnecessary pressure, and remember that taking care of your mental health is just as important as taking care of your body. When your mind is healthy, every other aspect of your life becomes more balanced and sustainable.